first responders will say, I was just in the parking lot at Walmart and I needed to go in and I'm having this large physical reaction. That's because that amygdala, talk about not being online, that amygdala has this kind of memory and this connection immediately with our body. And so EMDR does this great job of, I say, speaking speaking to our amygdala through our physical body. With EMDR, you're doing a lot of check-ins of notice what you notice in your body, doing body scans, starting at the top of your head to the bottom of your toes. What do you notice? Do you notice tension? Do you notice relaxation? Do you notice numbness? Do you notice nothing? Like all those things are ways in which we're trying to get that, to not let ourselves go offline, to use your. Hi, welcome back to the podcast. I'm Jennifer.
And I'm Ashlee. We hope everybody had a really great Thanksgiving.
Yes, we do. We do hope everyone has a good Thanksgiving. And we appreciate you checking out our thankful episode. And it's just us again. We are doing things a little bit different here lately, but I like it when it's just you and I
I know,
sometimes.
I kind of love it. I think people forget, like, everyone has lives and, of course, scheduling and things like that, but we are blessed. I mean, we are super blessed. We have some really cool things lined up. And honestly, like, it's really nice over the holidays not to have to worry about 1 million schedules and just us two.
That is the truth. I was on a text message chain about people trying to meet before, and I'm like, we're really going to try to meet before January. No, like that's just not going to happen. So, and we have a specific thing we wanted to talk about today, which is
Yeah.
EMDR.
Yeah, and I think that I want to preference something that came to me when we were trying to brainstorm. Hey, what do we talk about today, right? Like, what do we give our audience? Something that I think we fall short on when we're talking about therapy in general is that a lot of people have one thought process. And if there is something that I can say is that both of us are making waves and changing the stigma, especially with first responders coming to therapy, I still almost every day get the cliche of like, well, I thought therapy was, hey, tell me how this makes you feel over and over again. The whole come in my all my officers, my firefighters too, but I feel like my firefighters give me a little bit less grief. But hey,
Yes.
my police for sure will be like, oh, where's the big comfy couch that I get to lay on? And I'm like, okay, this is
Right.
not,
Right.
but I've also been doing a heck of a lot of ride-alongs, which is beautiful because one thing I always strive for in this, I guess, this career is that I never want to stop learning from them too.
Mm.
So one way I do that is to ride along with them. And in that ride along, I am doing nothing clinically. Of course, if we're stuck in a squad together for 8 hours, I'm going to talk to you because I'm just a talker. But I'm there to learn from you. I'm there to just be excited about what's going on. I'm not there to diagnose or evaluate or what have you, the person I'm riding with. And I get that every single time. They'll be like, Doc G is coming with me. Oh, they must think I need an evaluation. They must think. And I'm like, what? Like, that is not true. So that does often lead me to this discussion of what do you think therapy is? And while there's some truth to therapy being a lot about talking, right? And a lot about processing, digging, connecting things. There's also different ways that we do therapy now. And I think we could spend 6 years, Jennifer, like talking about all these things. But the one thing that I know both you and I kind of specialize in, you more so than me. So I'm going to pass this mic a lot,
Oh,
is EMDR. And I think it's important to talk about. And I think this episode, we're just going to bring it to light and then probably expand upon it in like a follow-up episode only because there is so much, but why don't we break down what that is? I think it's important for people to know that there's different things out there that we can do, EMDR being one of them.
yeah. Well, I think first is like, what does EMDR stand for?
Yes.
Which is eye movement desensitization reprocessing. I always struggle with the
Okay, I was
D.
just about to say I can never say that either. Like I literally can't.
Yes. And the Frances Shapiro is I wouldn't call her the inventor, I guess the discoverer of EMDR and kind
Yeah.
of move things forward with this therapeutic intervention. She said she wished to come up with a different name, and I kind of wish that she had as well. But it really is just a intervention that therapists can use that is a little bit different than talk therapy. I don't know, Ashlee, I feel like we started over. You made me reflect, like, gosh, what do people really do think that therapy is? But I'll be specific and talk about EMDR. So how I explain EMDR to clients is that it is a way in which the brain naturally heals itself. So in the eye movement, it's replicating our REM sleep, our deepest cycle of sleep. REM sleep is when your eyes are rapidly moving back and forth. That is the rapid eye movement that happens in REM sleep, which is a deep sleep cycle. A lot of our first responders don't get into REM sleep because
No,
of
they do
shift
not.
work, which makes it really difficult. And, something I think is great about the human body in a lot of ways, it's so healthy and can heal itself. So when I think like, oh, if I cut my finger, I'm not thinking, okay, I need to clot blood and grow a scab, grow new skin, that my body just automatically does that. And our brain has that ability too. When we rest, we sleep, we reprocess our experience of the day. And unfortunately, sometimes there's experiences that we have that maybe we don't get a good night's sleep afterwards. Or there's experiences that we have, especially when we're first responders, that, nobody should really have to go see or experience these things. There's no place in our brain to put some of the horrors that people experience when they're first responders. And what EMDR is doing is just taking that information. Clients can do different things like the eye movement, which is the replication of the REM sleep. There's also this fancy word called bilateral stimulation. It is just where both hemispheres of the brain are working. Okay, have I gotten too technical? Like, are you
No, you're doing a
okay?
great job. I always giggle when I hear, because when I explain it and I go, I don't know why, I go to the REM sleep part and I talk about the eye shifting. I'm always waiting for someone to be like, wait, what? Or like
Right.
freak out about that or be like, our eye shift. But yeah, no, I think you're
Well,
doing a
and
great
I
job.
I think that's always important. When I tell people that about sleep, I'm quick to say, I'm not putting you to sleep. I'm not hypnotizing you. You're
No.
awake and conscious throughout
Hmm.
this experience. And EMDR's been in practice for, over decades now. I want to say like 30,
I was
like
gonna say, I know it's over 30 now.
probably getting closer to 40, and technology has come a lot further. So as much as people do eye movement, there's what we call tappers, a real clinical word, but it's just this thing that will vibrate in your hand and go back and forth. I do a lot of virtual sessions, so I use eye movement a lot with virtual sessions, but I also have auditory. So it will go into one headphone, then the next headphone if people have headphones in. And then there's also tactical tapping where I just have people like cross their arms and we'll tap and I get to tap with them, which is I get some free EMDR sometimes when I'm doing that with clients. What I work with clients in terms of like a traumatic experience, and there can be one call that's a traumatic experience. And sometimes those are some experiences that as therapists we'll call little T's. They're small traumatic experiences. And sometimes those little T's can be a little bit harder than the big T's if we maybe had an experience with an adult that made us feel less than, or if we maybe had a thing at school that made, school was hard and we felt left out in groups. Like there's just these experiences that we have when we're little and we don't have all the information that are, if you think about our hemispheres, our left and our right and our thinking and our feeling, when we're little, we can get that really confused. And so EMDR can be a great resource sometimes for, my smart brain knows that I'm loved and cared for, and yet sometimes in my heart, I don't feel that way. And EMDR is a great tool that can kind of get those online together. It is a researched intervention. This is not just some therapists came together and like, hey, let's try this. There's lots of research that shows that as an intervention can be really helpful.
Yeah. And I think it's important to kind of do a little throwback to one of our very first episodes that probably hasn't gotten the attention that it needs just because we were really brand new babies to this whole podcast thing. But when we had Dr. Coyt on here, she did a fabulous job like talking to us about how the brain works, right? And what happens to the brain when we're in high stress situations. And I think that it's important when we're talking about EMDR to remember that prefrontal cortex, it's kind of a little bit offline. It's not fully there when we
Mhm.
are in a high stress situation, which makes it hard for us to actually reprocess things in a way that we typically would if it was a normal event. And so I always tell my guys and girls that come to me that in that moment, like your brain is still taking everything in, typically through your senses, but the piecing it together is kind of hard. And it'll take that situation and it'll store it away in your long-term memory in what I call the red filing cabinet. And it'll
Mm.
just keep doing that if we don't take it back out and reprocess it with our prefrontal cortex back online, right? To have those facts of everything that happened around us with that emotional side and to work through it that way. But I think that's something really important to recognize is that literally the brain is doing this to us when we're in these careers, and it's something that we can't necessarily help. It's just how we respond.
Well, and I think to that whole point, something I talk a lot about with clients is that EMDR is really working to speak to our amygdala, to that,
Hmm.
survival part of our brain, which is not our frontal cortex. It's not that smart decision making self. It is just about survival, which I think, is kind of cool that like our brain is wired in a way that survival, I mean, that's got to be the most important thing, not always about our happiness or feeling good. It's about surviving. And that connection with your amygdala and our physical body, if I'm running from a saber-toothed tiger, I can't digest my bologna sandwich.
Yes, yes.
I need to feel my heart racing. I'm going to feel sweaty in case somebody grabs me, like all these things. And we have these physical responses and that memory, right? And so that's why I think sometimes first responders will say, I was just in the parking lot at Walmart and I needed to go in and I'm having this large physical reaction. That's because that amygdala, talk about not being online, that amygdala has this kind of memory and this connection immediately with our body. And so EMDR does this great job of, I say, speaking aim and knee, speaking to our amygdala through our physical body. With EMDR, you're doing a lot of check-ins of notice what you notice in your body, doing body scans, starting at the top of your head to the bottom of your toes. What do you notice? Do you notice tension? Do you notice relaxation? Do you notice numbness? Do you notice nothing? Like all those things are ways in which we're trying to get that to not let ourselves go offline, to use your kind of metaphor, and allow that stuff
Yeah,
to kind of be processed in a way that says, I don't have to have a physical response in the parking lot. Like I can say, like, hey, I'm safe.
I'm okay.
Yeah.
Yeah, absolutely. Absolutely. And why do you, and I know I'm bouncing off of you here, but I do find that EMDR is like my first responders really take to EMDR. I happen to think that baseline, like not going anything significant here, I like that EMDR is structured. Feel like my first responders appreciate that too because they are more structured humans. It's more like this is where you start. This is right. Like and so there's a protocol to it, I guess is what I'm trying to say.
Right.
So I think that that's why my first responders really take to it. But do you have any experiences like you and I utilize EMDR a lot? What would you say is your feedback to that? What, do you feel like it's really beneficial for your first responders as well?
Yes, and a big reason why I think, I mean, I didn't really think of it in terms of the structure. I think it's more of like they don't have to talk. Like
That too, though. That too.
they don't, they kind of like that. Like they like that it's just first responders can be pretty in touch physically. Times there's some hurdles to being more in touch emotionally. And so I think sometimes it's a really great place to say, okay, I physically feel that in my chest, like that there's some tangibility to that that I think is helpful. And again, it's not kind of what you said of like the joke of, oh, where's your couch? And let me talk about all my feelings. It's a place of really, if you want things to be different, we can really roll our sleeves up and do some work here. And I will say, I did therapy for, gosh, I'm trying to think how long. I've probably been a therapist for like 5 years. And when I was in graduate school, like people talked about this EMDR thing, and I had some professors that were like, it's great. I had some professors that were skeptical. I mean, I think it still then was, I've been out of school for a long time, so still in its infancy some. And I think a big hurdle for some therapists is that it's pretty expensive to get
Yeah,
trained
of
in,
course.
yeah, don't get me started on that.
Hmm.
But anyways, when I had the opportunity, I felt very lucky. I had a lot of skills as a therapist, but this was a tool in my toolbox that really kind of can help, like in terms of like you see a little bit more traction sometimes. And that being said, I have people that are gang ho, I'm going to do EMDR, and then we get to it and they really need to be heard. They have
Yeah.
some pretty big feelings and feel ignored, and there's power in using your voice and talking and stuff. There's times where people come in, and I will say with EMDR, there is sometimes people feel kind of like, what are you doing here? And a little bit
Hmm.
of a loss of control, and that doesn't feel good.
Right.
And so sometimes you have to build some trust with
Absolutely.
clients. I think EMDR is great. I think if it was a silver bullet, then we would all be trained and it would be free and stuff. I
Yeah.
think it's incredible how the brain works and how people want to heal, and that it's a great intervention when the time's right for people.
Yeah, and I think what's really important and why we wanted to come on. So, this is a brief episode today, but because we're leading up to something more. And one thing that I think is just crucial that we wanted to take away with today is that there is other things you can do in therapy. And EMD, you said it best. EMDR is something that you can get help for what you're going through and maybe not have to be as talkative as you thought you would in the therapeutic
Hmm.
setting. And that's a really big deal for a lot of my first responders. And I want our listeners to take this episode and go maybe do some of their own research, scholarly. I mean, don't
Right.
obviously, right? Like we can probably find anything on anything, but just be
Hmm.
smart about the research, but look it up. Look up EMDR, look up other therapeutic interventions.
Right.
Because I think it's so important to realize that, like, hey, there's a lot of different ways we can get help nowadays. Two, we're definitely going to expand upon a lot more with this as time comes. And so it's just important to set the foundation as well of what EMDR is and why you and I both use it.
Absolutely. And I appreciate like what does therapy really look like? What is it gonna be? And I just know how I do it in my style. And with
Yeah.
that being said, like I still just sit on one side of that dynamic. So, I hope that people experience like feeling heard and understood. And one thing I always tell clients, and I think this goes back to another episode we had about cultural competent therapist, is therapy is just not one size fits all, and that can be hard.
Yeah,
Like, you want
absolutely.
somebody that feels like a good fit, and I'm very honest and transparent with people early on to say like, hey, it's not about me, it's about you. Like this has to feel like a fit for you. And so I think that's important to kind of circle back to. And I've worked with clients who have had EMDR with other clinicians and then doing EMDR with me. And the first thing I always say is like, hey, we're all going to put our fingerprints on this in a different way. And so just because this therapist did EMDR with eye movement and this one does it with tapping doesn't mean that one's better or one's
Right. Good
worse.
point. Yeah.
Um, and I do think though there has to feel a place of like you feel safe with
Oh,
that
absolutely. This is some
clinician.
intense work. Like I'm
Mhm.
always like, hey, I'm not gonna, I don't know, do we beep this? Bullshit you, but it's not easy. It's
No.
not easy work. And yet though the reward to it sometimes is worth it. It is worth it to do the work. But EMDR can be really intense. And so you absolutely have to have a safe place and build rapport with that clinician and feel good to do it.
Yeah. And I think that that's a real true thing, and that it can be like, oh, this is better, faster by some means, but it doesn't mean it's easier. Like that's the
Correct.
last thing it
Correct.
is. I know people that I took this from a client. They gave me permission to use this because I think it's a great metaphor, especially when I'm working with clients that maybe have some childhood stuff about some negative beliefs, like, for example, I'm not good enough.
Hmm.
Whatever reason that was like a seed that was planted when they were little. If you think about an adult who's, midlife, that I'm not good enough has turned into a 4-lane highway with a speed limit of 75 miles an hour. Like that is just an automatic thought. When there's something bad, there's mistakes that happen, it's on me. I'm not enough. And with EMDR, you're looking at closing a lane while at the same time you've created a new path. And on that new path, it's just a footpath right now. And with EMDR, you hope to like, oh, I'm going to put some gravel on that I am enough path, that positive belief, and hopefully shut down another lane of your highway. And so it's this idea of transitioning from this negative belief that's been there for a long time to, again, this true belief that I'm going to try my hardest or I'm going to do my best or, whatever that positive belief is.
Love that though. I love that.
Sometimes that can be hard to close down a highway, but I think it's really powerful. And I've worked with people that they've got a 2-lane road now instead of a one gravel path. And yet there can be experiences sometimes that, oh, I'm trying to get back on that highway. And so we've done EMDR, felt great, wonderful. And dang it, if life doesn't continue to happen sometimes. And what's great with EMDR too is like you can always come back. Like I've worked with
Yeah.
clients on a multitude of things over time. And that
Yeah.
wasn't, we were working together for 10 years and got all that. It was, we started and we worked on some things and things got a little bit better. And then I didn't see him for a bit. And then something hard happened and they checked back in and that wasn't as long. That was pretty brief. And so you kind of see that happen as well. And I tell all my clients, like, as long as my ears work and my mind's somewhat sane, I plan to be doing this. And so I think it is something that
I
sometimes you
love that.
can pick up, sit down, pick up, yeah.
Yeah,
Mhm.
absolutely. I love this. So I think that I know, short, brief, to the point in this little mini episode to get us back from the holidays and to get us rolling on some bigger things. Just to, I think that people enjoy these shorter episodes. We've gotten some feedback on that because it's a nice little drive to work. And hey, you learned something new today about EMDR. So we
Right.
hope everyone kind of takes something from it, researches it, and then comes back to us. Don't forget to pick up on listening to Dr. Coyt's episode too, because it's really going to start to piece together.
Yeah. And
So I don't
it's
want people
wild
to
to
forget.
think about how long ago that episode was. And we
It was
were
so long
little
ago.
babies
Yeah,
here, like especially getting into another holiday season. So thanks for checking us out and hit us up with questions about EMDR.
absolutely. And never forget that when the call hits home, Jennifer and I are here for you. Thank you.
Thanks. Have a good one.